We want to discuss a very important topic, which is the cost of waiting. Now, this patient that we saw here yesterday came to us referred by another patient that we treated. Now, patient have a lot of existing older crowns and bridges on the front teeth and a lot of failing root canals. So a lot of times patients are in cycle of regular dentists, hygiene, cleaning, and so forth. But unless somebody really takes a 3D scan and unless they take a proper diagnosis, you miss out. And when patient came for a consultation for implants, we looked at the upper jaw and lower jaw. The teeth were really failing. What we wanted to show is the upper jaw on the upper right and in the front. There were huge, massive changes in the density on the x-rays that showed that there's going to be massive bone loss due to failing root canals. When these root canals are successful, they're good, but when the crowns that's on the root canal fail, bacteria gets in there and causes decay, causes infection, and then starts eroding the jawbone. So this is what happens, the cost of probably not being diagnosed by the previous dentist and maybe just watching things. But in the medical community, they don't watch a cancer wait. They don't watch a cancer grow. They don't watch anything break. They fix it. So why in dentistry, we in the dental field love to watch things. This is a big problem. We're going to show what we did. Patient had top and bottom surgery done, but we're going to show that the cost of not having it looked at initially and how much damage it costs the jawbone with a big hole in the jawbone when the cyst was removed. So here's the upper right side. I'm just going to show one. You can look at that hole in that jaw right above the upper right premolar. That's probably about 10 millimeters by 10 millimeters, and it was at least another 10 millimeters deep inside. So I had to excavate all that bad bacterial growth that was from failing root canals, causing so much damage to that jawbone where we took it out. We took all the infection and cyst out from the front teeth, and then we grafted it. We grafted everything and we put it together, and we're going to show you what the cyst looked like. But lo and behold, we were able to get implants on the top where the healthy bone is, and we were able to get implants on the bottom. Let me show you what part of the cyst looked like, and that's all damaged bacterial tissue that's causing irreversible damage to the jawbone. Here is that piece of cyst. That's a big spongy tissue thing. This is sent to biopsy, to oral pathology, and we're just going to confirm that it's non-cancerous. We're just going to confirm that it's just dead cells and bacterial cells, and that's all that. It's part of our protocol. But this is what came out from the jawbone, and this is from remnants of bad teeth. So the cost of not doing anything when you have really bad teeth, whether you have gum disease, whether you have periodontal infection, whether you have broken teeth, failing root canal, this is going to happen, and that's bacteria that's going to destroy the jawbone, which is going to prevent us from getting implants. But good thing for our patients that we were able to get implants. We grafted all the sites that we took the cyst out of, and we'll show you just a scan of the implants that we put in yesterday. So here are the all-on-4 implants, all-on-6 on the top, all-on-4 on the bottom. This very last upper right side, and as you move forward, the second one on the right side, we grafted all that. So outcome was successful, outcome was good, but in these cases, with experience, with a lot of experience, we can navigate, we can do that. But if these just ends up in inexperience place, or somebody doesn't have a lot of experience, they wouldn't know what to do, and then that cyst would just grow and cause a lot more damage. So again, the message is don't wait. If you have bad teeth, broken teeth, damaged teeth, get them checked out. Have it looked by somebody that has a 3D scan so you can see any deficiency or any density changes in the jawbone that could impact future outcome. And obviously, infection in the mouth obviously can go in the rest of your body and cause other health problems.